Hi again, it's Matt from Glaucoma Pirates. Long time no see again. Been a bit quiet on the channel for the last few months. The reason for that is that, as you know from my last video, I was put on the waiting list, which was good news for my next bout of surgeries, which was back in May. It's now October, and I basically still hadn't heard anything from the hospital, although they did say that the surgery should be within 3 months. I have found out since then that there's long delays with the NHS, especially at the hospital that I'm at, mainly due to lack of consultants. The consultant that put in my bare valve implant and that I had been seeing and that has signed me up for the surgery in May, unfortunately is ill now and likely to be off until next year, which is really sad because you know, that's the person who's done a bare valve implant, so I was hoping that'd be the same person that finished the job, so to speak, but it can't be helped. It's the illness. They also really struggling to get new surgeons in and consultants with the right specialities, so it's really had a big effect on their capability to not just perform surgeries, but I imagine just to do the regular checks for glaucoma patients that we have to have regularly. I've heard stories that people are waiting like a year instead of 3 months, or 2 years instead of 1 year, and you know, the NHS is in a bit of a mess at the moment, and it's just what it is. So because of that, and having chased the hospital up and found out that at the moment they can't really give me an estimate of times because they haven't even got the surgeons that can do it, etc. I've decided to go ahead and go private and try and get this next surgery done, because it's just affecting my daily life really. The main thing that's affecting me at the moment is just double vision and not being able to see properly. The cataract is quite advanced now in the left eye, so if I close my right eye, I'm still pretty much virtually blind, although I can see shapes and light, but I can't make anything out. And the knock-on effect of that when you have both eyes open is that it just gives you permanent double vision, which is just horrible. Yeah, and it does affect you mentally, I suppose, as well as physically, bumping into things and stuff, but also it does get you down. You can't see properly and you can't do the things that you want to do. You don't feel safe driving and all that sort of stuff. So yeah, decided to go private. Had my first consultation with my private surgeon, which is again, this is the chap that I've used before when I had my trab and other surgeries earlier on in my journey. So I do feel confident with him. He knows my other surgeon that is unfortunately ill at the moment on the NHS, and he also works for the NHS as well at that hospital, so he can get information, and I feel very confident actually that this is going to be done correctly and everything. So yeah, I had my first consultation with him on Tuesday, where he just wanted, because I hadn't been seen since May, he just wanted to have a good look at the eye and assess where I am now. The good news is the pressure is still controlled. It's 15 at the moment, so the bare valve implant is doing the job, so that's great news. Hopefully I'm not suffering any more damage to the optic nerve. However, the bad news is that I've got another eye infection. I don't know if you can see on there. I'll put some pictures up of the last sort of 4 or 5 days when the eye infection kicked in. It was like being punched in the eye. Unfortunately, it's quite painful. I've had a couple of those infections now. It sort of swells up like a sty, and the reason for that is because of all the steroid drops that I've been taking for the last year. It stops your eye from healing, but it also stops your eye from stopping you getting infections and things and conjunctivitis. So I've had it a couple of times over the last few months, and it's just unfortunate that I had an attack of the infection just last week. So I'm on antibiotics for that now, to clear it up, ready for the surgery so that I can go ahead and have the surgery. I've also got to go back for other testing and scans and measuring and all the pre-op stuff that they need to do before doing the cataract surgery. At the same time as the cataract surgery, they're removing the wire from the barbelled implant, so opening that fully up. And it's been explained to me that there are sort of extra risks with my eye because it's had so many surgeries before and there's scarring tissues, and because the barbelled implant that I have is at the bottom of my eye, whereas it's normally at the top of the eye, and I have some wearing to my retina at the back of the eye because of all the surgeries. So I think this is why I'm having a lot more tests before the surgery, so they know exactly where they stand. But all of this gives increased risks after the surgery, presumably, and that I might have to have other things done. But at the moment, I just want to get the cataract clear so that I can get my vision. I know where my vision is and how much peripheral vision I've lost. I should be able to find out once I've got the fogginess cleared, and I'll also be able to get a new prescription, which I haven't been able to do for 3 years. So I'm quite looking forward to just getting a new pair of glasses and being able to see a bit better with my good eye as well. So that will be good. So that's where we are. I'm expecting the surgery to take place in sort of mid-November once this has cleared that up and everything else has all the pre-ops have been taken place. But I'll keep you updated with that. And that was it really. That's the update. So I hope you're all well. I hope your journeys are going well, and with glaucoma, and doorbell, it's time to go. Anyway, don't forget to subscribe. Thanks for watching again. See you soon. Bye.